All right, welcome. Thank you for joining us today as we celebrate the National Burn Prevention Week. Burn Prevention Week is Observance Day, that which is celebrated the first full week of February annually. It is celebrated to provide injury prevention tips on fire, burn, and life safety tips and resources to help the community and save the community on injuries that could be preventable. Today, we have a panelist discussion of physicians, electrician, and a life story, and also a firefighter who will join us to provide you with some information, and our social worker. We thank you and we look forward to you enjoying this session. Our theme for this year is electrical safety from AMP to ZAMP. So we appreciate you joining us, and here we go. Let's welcome some of our panelists. Dr. Burke. Dr. Burke is our Associate Medical Director for the Stuart J. Hulnick Burn Center, and is also our plastic surgeon at St. Christopher's Hospital for Children. We also have Sheree Hunter, who is our social worker for the trauma, burn, and the ED department at St. Christopher's Hospital for Children. We also would like to welcome Dawn and Luke, who is here today to provide us with their patient story and also the caregiver story on an experience as an electrical injury. Also is Celine Frazier from Frazier Electric, who will also provide us with some great tips and resources on how we can help and prevent electrical injuries in our household. And our firefighter, Namor Brown, will join us momentarily to provide us with some information as well. Namor is our Philadelphia community liaison, who tries to get grants for the community and provide free smoke detectors and installation that is done by the Philadelphia Fire Department. I am Rochelle Thompson. I am your injury prevention coordinator, and I work for the trauma and burn department at St. Christopher's Hospital for Children. Dawn and Luke, thank you again for joining us today. I want to start by asking Luke if you can tell us about your story. Give us some information of what happened on that day that you experienced an electrical injury.
Yeah, so basically it was about 3 years ago, and I was with a friend, and we were climbing on something that we should not have, and one of the electrical lines arced out into me, and I ended up getting electrocuted and falling a good distance. And yeah, ended up sustaining some pretty serious injuries from that. Yeah.
We can't hear you, Rochelle.
Just to reiterate, because you went down lower just a little bit, you were out with friends on power lines, is that correct?
Yeah, it was like a signal tower by train tracks.
Okay. Thank you for sharing that information. And that is, just that brief patient story talks about some of the electrical injuries that can occur, which can be a fall from an electrical shock, and electrocution, and also electrical burns. So thank you. And Dawn, as a caregiver, what was your thought that day, as a parent who gets this call, and our job is always to feel like we can comfort our children. What was your response?
I had a police officer come to my porch, and he had been with Luke on the scene, and he brought me to Children's Hospital, and it was, definitely the worst day of my life. And, but I'm really grateful to him, and he stayed calm and he got me there. I was grateful to everyone at CHOP, and then of course everyone at St. Christopher's, but it was awful. It was unbelievable.
Okay, great, thank you. Dr. Burke, when an electrical burn, I mean, what is the most important thing? Should people seek medical attention, or should they try to take care of this on their own?
Well, there's two kinds of electrical injury that are somewhat arbitrary, but we divide electrical injuries into high voltage and low voltage. And for people like Luke who sustain a high voltage electrical injury, it's generally going to be quite obvious that they need medical treatment. Many times they will pass out or be unconscious. Many times they will have fallen from quite a height. And they'll have obvious burns that look severe. I think sometimes when people sustain a low voltage electrical injury in the house, which is most commonly little kids putting things into electrical outlets or chewing on wires, sometimes parents may not be sure whether to bring their child in because the child really may be fine, like acting fine and look totally normal. But even with those injuries, usually it's important to bring people in because they can have injuries that you don't see. You know, sometimes you'll just see a little bit of blistering, or you may see something that looks like a severe enough burn that any reasonable person would take their child to the hospital. But sometimes they won't have anything like that, but they still could have things as serious as arrhythmias of the heart, which would need to be watched and treated potentially.
Awesome. Thank you. Thank you for sharing that information. And like you said, you know, those injuries can be more severe. What can, you know, if they don't seek, like you say, that arrhythmia of the heart, or things that you don't see, what can result in not getting that treatment, because those are the things that you cannot see and cannot detect?
Well, I mean, really the worst case scenario would be death. If somebody has a severe enough arrhythmia where the heart isn't beating normally, then they could potentially die. That's quite unusual, but not impossible. More commonly, they would have burns underneath the skin that don't look bad on the skin, barely visible. They might just have a little bit of a black mark or a teeny blister or something like that, or a white mark sometimes. But underneath the skin, there can be more severe tissue damage that we may not, and we usually wouldn't say rush somebody off to the operating room to treat that, but it's something that we would need to treat, and they would need to be followed by a burn specialist because long-term problems can happen from that kind of tissue damage.
Okay, great. Thank you. Celine, can I ask you a question in regards to, you know, I'm gonna say low voltage in the household, of somewhat of Dr. Berkey was talking about. What are some things that what type of advice would you give to a family in a household to secure their home, or who should they seek professional assistance for, to making sure things are done appropriately?
Well, there's a lot of tips you can do on making sure your home is safe. One of the most common ones, not to do with heaters, is GFCI, which stands for ground fault current interrupter, which should be in any place within 5 feet of water. So bathrooms, kitchens, you want to make sure that you have a GFCI. It kind of looks like an outlet, but it has a reset button on it. And this stops. Let me show you, get a little closer, you can see the difference between a standard outlet and a GFCI.
Okay, great.
This is so if something was to fall in the water, or you're near water and electric at the same time, it clicks off. It's supposed to click off within 1 second, versus if it's a standard outlet, it can take anywhere up to 10, 15, however long it takes that current to get back to your panel box, alerted and trip the breaker. So it's up to 10 times faster. So that's a big thing. I go in some homes and they don't have GFCIs in their kitchen working properly, or at all in the bathroom and kitchen.
Now that's great information. Now, will that be something that click off automatically when it comes to like steam also in a bathroom, or more or less just, you know?
No,
okay.
It's a current thing. So as soon as it's that electric as soon as it gets that volt, whatever it's plugged into this device, when it gets that volt,
Mhm.
it'll trip off. When I say instantaneously,
Mhm.
it'll trip off sometimes 0.7 seconds, 0.5 seconds. And that could be the difference between getting electrocuted and it just blowing the device and resetting this and cutting all electric before it can turn dangerous or fatal.
Oh, wow, great. Thank you. Now should people look into installing that themselves, or should they seek somebody who is a certified electrician?
For the most part, it should be done by a professional electrician. It doesn't have to be done by a master electrician,
Mhm.
which will cost way more money. Whether you can get like an apprentice to do it on his day off, it's fairly simple. You know, you can watch videos on it. You can turn the breaker off and do it yourself. But I'll prefer that someone that works for an electrical company that's not the head guy, or someone just to try to save you money, because getting, master electrician out there could be pricey to do one item.
Okay, great. Thank you for that information. I greatly appreciate it. And with, I mean, we can go over a whole lot of things that go on in our household. And, especially with our toddlers in our homes who are putting in bobby pins or, regular pencils into sockets. What should parents or caregivers do to secure those outlets even in the household to protect their child?
There's two different methods. We have kind of like the standard method, which the rubber or the plastic plug-ins that you can put in. But sometimes, you take something out to plug it in and you'll forget to put it back. So they have a new code, which they started implying, I think, on 2003, which are tamper-resistant devices. It says it on there. So what this is, your standard outlet, these two prongs that plug in are just open, kind of like the ground hole at the bottom. On the tamper resistant, it has a piece of plastic that's covering the seal. So if someone was to try to plug a fork or knife into one prong, all three have to kind of be depressed at the same time in order to insert. And these are fairly inexpensive. You can get a box of 10 for around between 16 to 20 bucks. So that's anywhere between $1.50 and $2 a device, which is fairly cheap. And toddlers, you cannot plug one thing into one prong and it opens up to the electric. It kind of blocks it. I'm trying to get close. I don't know
That's
if you can
perfect.
see the plastic port that are covering. It's not fully open.
Perfect. Oh,
We
great.
this is every house, that we deal with come across.
Okay, that's awesome. Thank you. And even like, as a person who is renting a home or in an apartment, should they be checking for that and then contacting their landlord to make sure that, again, their household is secure with what is needed to protect their home?
Yes, to keep your home up to code, it definitely should have tamper resistant outlets. You can look it up online to find the national code and maybe present that to the landlord and get them to swap it out. But normally they have electricians and handyman on board that shouldn't have a problem doing it. You can change your device out normally within 2 to 5 minutes a piece. So it's not a process that takes super long to take a bunch of time to do.
Awesome. Thank you for sharing that information. I greatly appreciate that. You know, Luke, I'm gonna come back to you if you don't mind. And I know we're gonna, go back and forth between some home safety and also some outdoor safety, because outdoor safety when it comes to electricity is also very important. And we've seen it done with individuals who have sockets outside and pools outside, and the close contact that have occurred with different injuries that we've seen over the course of the year. I don't know if you want to express or talk about, any sustained injuries or damages that that you can just express to the community of what advice you will give to them on how to be safe and what you went through in addition to what you stated.
Yeah, so kind of the big injury that I did sustain from the accident was I did lose 2 of the toes on my right foot where the electricity had exited. And then as far as just like general advice, I mean, the best thing I could say is like the reason that I did get injured is because I didn't stop and look at what I was doing and try to like see the telltale cues that there was like electricity there. So the best thing I could say is like take a step back, especially if you're doing something that could be dangerous, and just look around and try to observe the environment and see if there is something that could cause you injury that may not be jumping out immediately.
Okay, awesome. Is there anything like, when you say see something, is it, when they have certain signs that say voltage, or, or what things that you think that they may see, or may, what will tell them not to do something or to look at that current possibly?
Yeah, I mean, definitely like warning signs, high voltage signs, like even just looking for like the presence of a power cable or something like that. Just anything that can tip you off to the presence of electricity or.
Okay, great. Thank you. And Dawn, I mean, I know, as a parent, again, that was a frightening day for you, and Luke has come a long way. And, what have you done as a parent to bring awareness to the community, and, to promote education?
Well, after it happened with Luke, I heard about other kids that it happened to over the years in our area. And so I tried to find information on train track safety. And when I got the information, I shared it with the local schools. And I had a friend who said that she went through that training when she was a kid at school, and it made a difference. And I felt like we hadn't had that experience, and I was hoping that the schools could share that information. And I know kids do that. They climb, they stand too close to the train tracks. Even just standing close to the train tracks causes harm. So I just wanted people to be aware of what could happen.
Okay, great. And did you go out to schools and so forth as well and speak, or?
Didn't know. I just contacted local principals after I found the information.
Awesome, great. Just by providing them with the information, and that is so important. And sometimes that's just taking that extra step to say, this is what has happened, this is my experience, but this is what's out there, and this is how we can help prevent someone else from injury. So thank you for doing that.
One of the physicians at CHOP contacted us a few months ago. And so they were submitting a paper because she said it was so unusual for someone to have this accident and survive, and what they had to go through trying to figure out how the electricity moved through the body, through the heart. And they wanted to publish the photos and the article. And so I thought, great, please do that. Please share that, because they learned a lot from that experience and how to treat someone.
Okay, awesome. I believe we've also published some information on some information regarding this as well. So great, thank you for sharing that. Sheree, thank you again for joining us. For Dawn and Luke, when this experience occurred, and here they are, as a patient and as a caregiver, and you speak with every patient that comes in here, these traumas and our burns, what resources are available to them psychologically and emotionally and et cetera?
So here at St. Christopher's, we have a ton of resources available to burn survivors and their families. The first stop when it comes to emotional and mental health support is we have 2 social workers here at the hospital, myself, Sheree Hunter, and Ashley Morris. I've been here a little over 3 years, and Ashley has been here over 10 years. So one, we provide bedside support while they're here at the hospital emotionally, and then also connecting them to resources outside the hospital based on each patient and family's needs. In addition to the emotional support, we do, after their discharge, complete PTSD screens on all patients over the age of 1. We assess 1 month post date of injury, 6 months 1 year, just to check in and see how they're doing. We also provide information about school reentry. So providing the school counselor with information about helping the child return to school with that information. And then we also have a peer support program and a support group, which the Phoenix Society certified some of us and some of our peer supporters. The peer support group is basically a group of some survivors and their family members or friends. It's open to anyone who's experienced a burn injury or their family or friend who would like additional support. And then we have our social workers, our child life specialists, and then we have some guest appearance from the medical team that sometimes come in, and our injury prevention coordinator. And prior to the pandemic, we used to meet in person, and it was a really good time for the adults and the children to separate out in 2 groups. And then the children went over their shared experience and what their thoughts and feelings were. And also in the parent group, we did the same. The peer support program is for individuals who may not necessarily feel comfortable in a group setting, but they still want the support. So that's a more individualized approach in which we connect a peer supporter or a patient with each other. Right now it's via phone. We used to be able to have them come into the hospital while they were admitted to the hospital, but right now, due to the pandemic, we are connecting them via phone. So those are some of the resources we offer here. Our program has really developed over the past couple of years. We didn't used to have these services available, but we acknowledge that there is a serious need for burn survivors to have this emotional support. So we were really happy to offer these services to them.
Awesome. Great. Thank you so much for sharing that information. And I believe Dawn is one of our peer supporters as well. She went through the training, so thank you. And like Sheree stated, that support system is available. It doesn't necessarily, it's not necessarily available just when you're in the hospital. That can be 6 months after your discharge and so forth. You know, sometimes everybody goes through a roller coaster of feelings and emotions that determine when they are in need for that emotional support.
Right. And some of our peer supporters are teenagers as well. So in addition to having adult providers, we also have teenagers that can connect to other teenagers as well. A lot of times the services is offered to every family that comes in, and it's always going to be available to them. A lot of times we get a lot of burns where they're very baby, tiny infants. And they may not recognize what's going on, but later in life, they may have body image issues and things like that. And those things will be addressed later in life. The service will always be available to them.
Awesome. Great. Thank you for that information. I greatly appreciate it. Dr. Berkey, I'll go back to you. I know, going back and forth. But Luke has shared information on that he experienced some damage or amputation to 2 of his toes. Is that normal? Is that usual? Or, could you talk more about those type of damages that can occur from an electrical burn or electrical shock?
That kind of injury is pretty typical for high voltage electrical injuries. And I would say really Luke in a way was fortunate that he didn't have to have more severe, more extensive amputations. It's pretty common for people who have high voltage electrical injuries to need amputations of hands, part of the arms or legs, something like that, because the damage can be so extreme. Now, I think one of the reasons maybe that I think Luke, the reason that he was injured was from an arc injury. And often what happens with high voltage electrical injuries is a person like a construction worker or an electrical worker will lose balance or fall or something like that and actually grab a wire. And when that happens, usually they're going to lose at least some part of the hand or arm that grabbed the wire because the damage is just so severe. That's certainly one of the most common things that we see with high voltage electrical injuries. Other things are irregular rhythms in the heart. The heart can stop. The heart can go into fibrillation where it's just trembling and not beating correctly. There can be neurologic injuries, like nerve damage of varying sorts. We've had patients who have had cataracts, so it can really affect areas of the body that or organ systems that you wouldn't necessarily expect, in addition to the most common things, which are muscles, skin, and sometimes bone. And I would say often bone, because bone is one of the tissues that tends to be the most affected by electrical injuries.
Wow, great. Thank you. Thank you for sharing that. And it's funny that you talked about how even electrical workers experience these type of injuries due to falls when they're coming down, because that is something that the Center for Disease Control also mentioned of, electrical workers being in, although that's their workforce, that they are in a dangerous area. So, their work is very dangerous and serious. And for them as electricians, knowing how serious it is for them, and us as non-electricians, you could imagine us not knowing this information and how serious it can be for us as well.
They're really the most common people. I don't know about if they're electricians in particular, but adult workers who are working around or with power lines are the most common people who get injured that way.
Awesome. Thank you. Thank you. Salim, may I ask about, when it comes to like your cords in your home, how can someone tell that their cords are damaged or should be replaced, or having too many plugs in? Like, what are some other key factors that someone can help avoid or prevent in their household?
Yeah. So one is the reason why you're not supposed to plug into an electrical extension cord or a power strip is because the voltage coming from the actual heater can be up to 500, 600 degrees Fahrenheit. So let's say you have something that's pumping 20 amps and you plug it into a thin cord, which is only rated for 15. You're trying to send double the voltage through something that can't handle it. That's the most common, failure with extension cords. It can't handle the power of the actual heater.
Okay.
That's why you're always supposed to plug directly into an outlet. And also you're not supposed to have anything else plugged in to that same outlet, because normally there's two prongs. So you plug your heater in one and you do not use the other one for anything. You don't want anything close. You want like a 3 feet clearance around the heater at all times. Anything that can get close to burning, whether it's close to wood or close to a curtain, you always want 3 feet all the way around.
Awesome, great, thank you. And kitchen appliances, how about unused items? If you have all these items plugged in, you have your toaster, you have this, all these appliances plugged in, and some of these appliances have all these automatic shut off, and I get that, but should they still remain plugged in, or should those unused appliances be unplugged?
They can stay plugged in. I normally unplug certain stuff that I don't use. If you use something daily, I guess you can keep it plugged in. If you don't, then I would recommend unplugging. Now, the electrical code is very strict when it comes to kitchen. You cannot just have one circuit provided for all the devices. So let's say you have 6 devices, 6 different outlets in the kitchen. All 6 of them cannot be on one device. You have to split that circuit up. Regardless if it's only 2 circuits, they have to be 2 devices. So the code is very strict on keeping people safe in their kitchen, around water and all of that stuff. But you can keep appliances in because they're always rated for 20 amp. They always have your GFCI outlets in there to protect the current.
Awesome, great. Thank you for providing us again with that information. Hi, Namor. Thank you for joining us. How are you today?
I'm good.
So
Sorry I'm late. They got me running around.
That's okay. So I'm gonna ask you a couple questions, Namor, if you don't mind. So on average, I don't know if you know this information, on average, do you know, or estimates how many fires may occur or start from electrical errors, in someone's home?
So that's kind of hard, right? So when the marshals go out,
Mhm.
they determine what started the fire. Right now, we're averaging um, we're averaging about 10 fires a day, right? And a little fire, can just be something small. Doesn't necessarily have to be huge, right? But
Right.
we're averaging 10 fires a day. Our biggest causes of fire to date are still wires,
Mhm.
careless cooking,
Mhm.
and smoking. So it's
Mhm.
still in the top three of the most fires that occur in Philadelphia.
Wow. Okay, great. Thank you. And, could it, I mean, on average, this, when the fire marshal goes in, or when you get information coming back, does it state, like if it was wires, was the wires damaged, or was it, too many wires plugged in, or, any other details to provide to the community as to why it's so important not to do, or how to prevent those certain things?
Yeah. So one of the biggest problems in Philadelphia, right? There's a bunch of problems, right? But one of them is the fact that over 65% of the homes in Philadelphia
Mhm.
were made before World War II.
Mhm.
65% of the homes in Philadelphia were made before World War II. The other fact is that the poverty level, right? We have like almost 30% of
Mhm.
people who live under the poverty level.
Mhm.
How that's big is because now you have a aging home with aging wires and new technology and new appliances and new things that are
Mhm.
calling for more power than the house was intended for.
Mhm.
So they're not, it's expensive to replace the wiring inside their houses. So there's still now, the blow dryer, right? Just a simple hair dryer. It wasn't invented, 65 years ago.
Mhm.
That thing is sucking a lot of energy, right? And it's making the wires hot behind the walls. There's still knob and tube. There's still circuit breakers, and I mean fuses in people's houses. So those things combined with overloading the circuits is where we see a lot of problems
Okay, great. Thank you for sharing that, and thank you again for what you do and the Philadelphia Fire Department does, for the community and protecting us. So we greatly appreciate that. So
at.
go ahead. I'm sorry.
No, I just said thank you. Thank you for the invite. You guys have always been awesome with the reach that you're trying to do with the community. So anything that we can do and help, we're only a phone call away. Again, I apologize that I'm a little late, but with the storm, they got us running around doing some crazy stuff.
No problem, no problem. So lastly, because I know we're coming into closing up a little bit, but I just want everybody to give one tip or one resource that you can think that you can to spread the word today to someone in their household that don't know what to do, or what is your recommendation? Just one thing that word of advice to them. So let's start with Sheree.
One word of advice I would offer is for families and patients that they have any concerns about emotional and mental health. When you have a follow-up appointment, just ask the doctor or nurse to speak to a social worker. There's always a social worker available at our hospital and any other hospital or primary care doctor's office. If you don't have any appointments coming up, but you still would like to speak to someone, feel free to call your doctor's office and ask to speak to a social worker, because if there's something that you need help with, we would love to help you. Thank you.
Thank you. All right, let's go with Celine.
I actually have a few.
Mhm,
There's new technology with the smoke detectors.
mhm,
They come with 10-year
mhm.
built-in batteries. I know a lot of the cases, the batteries die, people forget to change them. They install the battery in backwards so it doesn't work, or they cooking and it goes off and they take the battery out and forget to replace it. Now with the new smoke detectors, it has a 10-year built-in battery. There's no excuse for your house not to be protected.
Correct. That's correct. All right. Anything else? I thought there was a couple of things. Okay, great. Um, Luke, what is your word of advice for your teenagers or in the household anywhere?
I would just say like staying aware of
Mhm,
your surroundings and
mhm.
what is around you that could potentially be dangerous to you, especially with electricity. Yeah.
Great, thank you. And Dawn?
I guess I would just say to kids, just don't even go near train tracks. There's no reason to do it. Just stay away. And and you guys have been so good, St. Christopher's, and for families to take advantage of the supports you offer. You're doing incredible work, and we really appreciate it.
Great, thank you. It's as Luke said, and yourself going about just staying away, is also letting them teenagers know, we all have a choice to make, and although, is peer pressure and you with your friends, we have a choice to make a decision and say, no, that's not for me, or telling our friends and family, to stop and stay away. So thank you, Luke, for also bringing awareness to the community with that. Dr. Berkey?
I pick up on what Dawn just said, really, and say it's better with electrical, high voltage wires, things like that, to just stay away, because as we discussed, you don't have to come in contact with something that's running electricity at that high of a voltage for you to get seriously injured and or killed, really, because the electricity can jump further than you might think. So I second what Dawn said on that. I'd also say thanks to you, Rochelle, and to Sheree for really being the main spearheads and drivers of a lot of the programs for prevention and peer support that you guys have talked about. You guys really did the lion's share of the work on those, and have really provided a lot of energy for those programs. So thanks to you guys for that.
Thank you. Thank you, Dr. Berkey. Greatly appreciate you and all that you do for taking care of our children and our next entrepreneurs of this world. So we thank you. Namor, is there any word of advice or anything that you will say to the community of recommendations?
Yeah, so wow, there's a couple of things, right? So one, with the smoke detectors, right? So if you don't know, because they need to go in certain places, and one of the big things it was touched upon earlier with the batteries, right? So now the 10-year lithium batteries in them. So, but if you put them too close to the kitchen or your bathroom, the steam, they're gonna go off a lot, and then you're gonna knock it down. And then once you take it off from the ceiling, it's and you put it in a drawer, you don't have a smoke detector, right? Because it's not gonna alert you. So I would say have a home escape plan for the family and practice it. Two, any questions as far as smoke, call your local fire department. And they'll come out and they'll show you where to put it at, or they'll put it up for you for free. It's not going to be a charge. And no question is a bad question, right? If you really have a question about something, whether it's your space heater, whether should you touch this or don't touch it, ask. Just really seriously, just ask a question. And always read the owner's manual for whatever you buy. So when you buy something, whether it's a extension cord or a heater or appliances, and then they're going to tell you how to use it best. because there's so many different manufacturers out there and different regulations, and some people live in the city, some people live in the suburbs. So even those fire codes are different, right? I mean, there's a standard, but it's just different city to city, state to state. So just ask the question and remember, most fires happen at home. So protect your home and hopefully everybody will be okay.
Great point, about the smoke coming up with an escape plan, especially during the winter month. A lot of things are done, and I'm pretty sure Salim and Namor, you see this a lot about, electrical wiring done unsafely, due to sometimes winter months, people electricity might go off and so forth, and errors are being made. So but coming up with that escape plan is so important for your household, and for everybody to know what to do in the household, not just the one person, but everybody should know what to do. In closing, I just want to say thank you all for coming out today, sharing your story, providing advice, providing preventative tips, providing resources to our community on this National Burn Prevention Week. We will continue to be educators to the community, to prevent and try to avoid as many injuries that are preventable, that we can help with. Education is key. But also knowing where to obtain those resources from. Like you say, here is a smoke detector. You have it, but you don't know where to put it, where it belongs. Contact your local fire department. Contact 311. Call them. Ask them for those questions. Contact your landlord, but also more importantly, read instructions. Sometimes we don't take the time out to read our manuals, which is so important. We just think we just want to do it, just take too much time, but it will be more important and preventable in fires and electrical injuries if we just take the time out to read the information and to ask questions. And as Namor stated, no question is a dumb question. We all here to learn and to help promote. So some of our great preventative tips, as everyone stated, thank you for acknowledging that. Contact your landlord, contact a certified electrician if need be, contact your local fire department. Seek medical attention if anything occurs. Seek medical attention. Don't take it upon yourself to think it's okay. Just seek it and then allow the professionals to tell you what's the best method and what needs to be done moving forward. Get the resources psychologically, emotionally that you may need. That is important, not just the day of the incident, but going forward. Sometimes we don't know what we're going to experience on that day, and everything seems a fog. Most of the time at that point of service, but a lot of times things come to light later on, and we do need those services. So again, we're here for you. We wish you a wonderful 2021. Please be safe, wear your mask, and continue to practice social distancing. Thank you, and have a good one.
Thank you.
Thank you.
Thank you.
See everybody.
Thank you.
Thanks again.
Okay.